back on with us. He was in the clinic. I think he was at the hospital last time we had him. Oh, there he is too. Hey man, can
Can
you
y'all
hear
hear
me?
me?
Yes,
Yes,
sir. Can you
sir.
hear us?
Yeah, thank you so much,
Oh,
Mike and Rudy, for having me on again. I had
good
a
to
No
have you
blast in
problem.
back on, man.
February, and was a
Yeah,
great
where
story to
you
tell
at?
my friends and family. So
Cool.
glad to hear from you again, and looking forward to it.
All right, so let me set this up. It's Dr. Thomas Gianis. He is a board certified vascular and general surgeon with a medical vein clinic here in town. We had him on the day that we found out that Wimby was done for the year because of the blood clot. And we thought we'd have Doc back on today just to reassure me one more time. Doc, all I want to hear from you is Wimby is absolutely fine. Forget it ever happened. Is that what you're going to tell me?
I think that's the case. I think time will tell as the season
Oh,
goes
okay.
on. I can't give 100% accuracy to that. But, I think from everything I know in the news and talking to some colleagues around town, I think he's going to be fine. I don't think he's going to be limited. I still think he has all the superstar potential he had before. And I think with everything else, with the moves we've made in the offseason and some of our potential kind of poker chips we've had in the past, I think we're on the up and up for sure. I cannot speak exactly to his functionality, but I think in terms of what he had done, I don't think he's going to be limited much. And I think obviously he's been in very good hands. He's had 6 months to recover, and I think he's going to be ready to go. So I'm buying in.
So what? This is my question because I know that when they came out and said he was cleared, it was like, hey, we're fine. The probably not going to happen again. What causes it, and what gives them so much confidence that this is a one-off type situation?
I hope all the information they're giving us is accurate, not only for the media and basketball fans, but also for Wemby and the team. I know for a fact he definitely had a blood clot. I think it was from thoracic outlet again, that tight triangle of muscles in his neck causing a pinched
Mm.
vein and subsequent it clotting off. All I know for sure is that he's had a thrombectomy, which is they remove the clot to kind of clear up the plumbing, and then they give you a blood thinner to kind of make sure all that residual clot doesn't recur. I have not heard, nor has it been in the media or from anyone that I know, that he's had surgery to relieve the actual obstruction. So I think he had the removal of the clot, and they were going to treat him. Standard care is about 3 to 6 months of a strong blood thinning medication, of which you probably do not want him on for any sort of contact
Oh,
sports. Definitely,
okay. Yeah, I was going
hockey,
to ask
lacrosse,
that.
all that kind of stuff.
Yeah.
But I
How long are
presume
you
that
supposed to
he'll
be
be
on
off it.
those? How long should you be on a
So
blood thinner?
yeah, so if you've had like a recurrent blood clot or you've had a clot that's gone to your lungs and caused a life-threatening problem, the recommendation is lifelong. But if you've only had a single
Mm.
clot, the inciting event has now been resolved. It's about 3 to 6 months is the newest recommendation by the chest guidelines. The guys kind of come together and talk a lot about this. So this was in February. So, the season schedule I don't think is out yet. But October should be the first game, end of October. So he should be good to go off blood thinners and have the green light. And I know just researching in the news in France and here, he's been doing physical therapy. He's been working out, doing weightlifting and all that. So, again, is there a chance that he's limited going forward? Maybe, but I would definitely bet highly that this is going to have a minimum impact on his game and his functionality moving forward, which is great news as a Spurs fan and Spurs Nation. So
All right, Doc. So we're seeing him. I heard that he added 30 pounds of muscle.
I
He's
hope
going
so.
over. He's going over to Japan, and he's playing soccer with a bunch of kids and doing impromptu uh, street
Chess
games
matches
with
in New
kids.
York
Yeah,
City.
yeah. So and then I see him try to bicycle kick, and of course, this is just I'm ignorant to this, so I'm like, I that that blood clot better be fine if you're out there bicycle kicking and stuff. Now he did skip the Euro Championships, did not play for the French. So I guess I needed your reassurance, and I feel better again by having you on. So
Yeah, it would worry me watching him do bicycle kicks too. But the blood clot
okay,
after about 7 days, it's like concrete in there. It's not going
all
to go
right.
anywhere. When we first saw blood clot, we worry about it moving kind of the lungs and moving to other places and causing
Uh-huh.
much bigger issues. After about 7 to 10 days, it's like concrete. Then you sort of switch your frame of reference into you're worried about what is the consequence of not having that outflow over time, having a pipe that kind of has concrete in the middle of it. But they've probably gotten most of all of it out during that initial surgery, and the blood thinner took care of the rest. So I'm all in on the Spurs, and with the new draft pick, Dylan Harper. I'm from New Jersey, a Rutgers guy. I can't claim Rutgers. I'm not a Rutgers guy, but New Jersey, Stephon Castle, De'Aaron Fox coming back. I think the Spurs have a lot going for them, and I'm excited.
I know most guys they always wait to have surgery because if you can avoid going under the knife, they do. If you feel like the blood thin, I'm asking because I'm ignorant to it. If you feel like the blood thinners work 3 to 6 months, doc, why even have the surgery and remove it? Why not just put them on the thinners and see if it kind of
Yeah.
knocks itself out?
Absolutely. So there's definitely areas of the body where this has shifted. In the past, we used to do open surgery to remove clots, of which the morbidity or risk of that surgery was much higher than the
Mm-hmm.
newer techniques that have evolved in the last 10 to 20 years, where we could just make a little poke with a little ballpoint pen through your
Oh,
vein, go
okay.
in there and suck the clot out with basically like a vacuum cleaner, and it kind of emulsifies the clot. That sort of removal of the bulk amount of clot does a lot more than just the blood thinner. So it's sort of like, let's remove all the dirt and then we'll mop afterwards. We'll use the blood thinner
Got
to
you.
kind of clean up the residual stuff. But the outcomes are definitely better if you can remove the majority of the clot. That combined with the advancement techniques and the less risk that the surgeries are nowadays has shifted us towards a more aggressive approach in terms of removing blood clots. And particularly in a young athlete like him, of which having what we call post-thrombotic syndrome, or having that clot be there and solidify over time, could limit his arm. And so I'm glad they did it. I think it was the right call.